Hi, I'm Megan Kingsley Gale with the Hospital Handbook Project, and today is December 11th, 2021. So, today we had a community discussion session that was open to those of you who have joined the Hospital Handbook Project community. So, when you are in the new platform, so you go to community.thehospitalhandbook.com. That logs you into the new platform. You can join at tier one or tier two. And to learn more about this, go to the blog post titled Join the Discussion. And a lot of several of these things that I'm talking about today, I will add like a PDF to the main place where this is posted that will have the hyperlinks to these things. So if you're seeing this on a platform or shared on a platform that doesn't have the hyperlinks, try to find the main hyperlink that this or post that this was originally posted to and go there to get the PDF with the resources. So if you're in the discussion group, this will be really easy to find. If you're watching this on YouTube, you'll likely have to go to the discussion group to get the links, all the links that I'm referring to, all these references. So as I'm recording this, that's my understanding of where I'm going to be able to post this and share this information most easily. So again, I'm Megan with the Hospital Handbook Project, and thank you everyone who is supporting the Hospital Handbook Project. It makes a big, big difference. We are a very small not-for-profit community resource project with a small budget. And every little bit that you can do to support helps, whether that's virtual coffee or joining the platform. So for information like this, you really have to join the platform to get the information soonest and with all the references that I reference. So just a little update on our negotiations with the full 501c3. It is going well. We just got through the latest level of negotiations, so that's good. And when I have more to share, I will definitely do that for you guys. So just for now, know that things are going well. We're making progress. It's just a really long process. But it's good things coming. For those of you who didn't know, I co-presented with Amy Goldstein of the AACIPM, which is a big group of all kinds of integrative health professionals working in integrated and integrative pain management and comprehensive pain management programs. So I recommend looking up AACIPM, and I'll add the link here. But we co-presented at the I Am For Us conference in September, and I'll link to some of the information on it. But I got to help share the stories of some of our hospital and healthcare system-based colleagues in, especially like Risi Idiokitas, her work at Children's Hospital in DC area, and our colleagues in also working in private. There are a couple colleagues working in private practice, and Laura, who's working at a county clinic out in the Portland area, Multnomah County. So I would love for you guys to check that out. We're really focused on how these colleagues have been bringing acupuncture to the local populations, and how that works, and how they're being culturally sensitive to that, to the groups that they're working with, and how that program works for each of them. So I recommend checking that out, especially if you're a member of I Am For Us. If you've never heard of I Am For Us before, you can look it up. I am for the number 4 us.org, and I'll add the hyperlink in here as well. So some of you may have noticed on our events page on the website that I put on there that we're moving. So we did do a huge family move, October, November, and we're still doing some settling here in December, and going through a lot of transitions. So that was a big thing that went on. So we were looking at the schedule of events with the Hospital Handbook Project. There was a break there because of that. While I was doing that, I had been asked to present at the Atlantic Symposium. So I was able to go ahead and do that, which was great. I was able to do that because with moving, sometimes I had agreed to the Atlantic Symposium when our moving dates were going to be earlier in the season. So it ended up being kind of a tight turnaround, but it worked out really enjoyed presenting with and sharing the Hospital Handbook project with colleagues at the Atlantic Symposium. Thank you. If you attended, thank you for being there. And then if you attended, there is a PDF of my slides available. If you're interested in some of the topics I talked about, just message me through the Hospital Handbook project contact page. We talked about basically it was about first steps for the practitioner or student interested in hospital-based practice. We do have a first steps resource at the Hospital Handbook project. You just go to the tab that says first steps. But then I also talked about language in what is professional practice, and how what we do is professional practice, and how that language plays out in the language that's used in hospital and healthcare system-based practice for different institutions, both federal and civilian, and how they define the difference between technicians and professionals, and how that works with what our education, training, roles, and responsibilities are as acupuncturists. And then I also talked about hurdles in hospital-based practice, both on the hurdles as an individual clinician, acupuncturist working in hospitals, and then hurdles from the perspective of the organization and program manager, and the hurdles that they have to overcome. So just kind of talked about the list and then a little bit on that. So if those are topics that you guys would like me to hear me talk more about, just message me, let me know. And if there's interest, I can certainly talk about it and share slides, that kind of, or, create new slides to fit the type of information that you're interested in as related to that. So just message me on the website. In the community discussion group on the new platform, that's the community.thehospitalhandbook project. I'm sorry, community.thehospitalhandbook.com. Or you can look on the website and go to the blog post that says join the discussion to learn how to connect to that. We've been talking about safety in practice. So there's an internal blog post that just lists basically all the different aspects in practice that relate in acupuncturist practice, as we work in hospitals, that relates to safety and quality assurance. So it's a long list, and just kind of as a checklist for you that these are things that are related to safety and quality assurance that you should have an SOP, standard operating procedure, SOP for, or maybe one SOP that, for some things, you might have one SOP that covers several of related topics, or trainings, internal trainings on that. So everything from, dropped needle to suicide awareness and prevention training, and resources for that. So there's been more interest in that. So I'm working with Christine to create more usable resources for that. So we'll give you an update when we're farther along on that, whether that's kind of talking about like what kind of resource would be most usable for that kind of information besides just a blog post. But just as a reference, we talk about safety and quality assurance like all the time. So if you haven't been part of the community discussion, or you've been really busy and you are in the platform but haven't had time to pay attention, not just in the new platform, but for years, I talk about safety and quality assurance and how that relates to whether it's the Joint Commission or just basic standards of practice, and what the resources are for looking at those things, for creating basic standards, and then how that relates to program standards, and then how that connects to your mission and collecting metrics, personnel metrics, clinical metrics, and then how that relates to how, in general, hospitals are looking at metrics, both from a safety perspective, from a RVU perspective, and then from quality assurance perspective, which goes with safety, and also looking at like what are the related quality improvement processes related to that, and how that connects to your quality assurance processes, and then how that connects to, I know, kind of getting a little deep in this right now, but I didn't mean to get quite as deep of a dive, but then how that relates to like professional practice standards, which is your, FPPE and OPPE in the United States. So we actually have deeper resource than just that safety and practice blog post, that we have an online resource for hospital-based practitioners that's called the Joint Commission and Other Quality Assurance Standards, and talks about all those different metrics that tie into your practice, from Medicare to the BRE Collaborative to Leapfrog, and what the hospital safety score is and what kind of things that they're looking at, as well as other things. So like this last spring of 2021, we had a session on, and you can find this in the events page on the Hospital Handbook Project website, on peer record review, what the community standard is for peer record review and what that looks like. So not just talking about what it is, but then also giving you guys examples of what that looks like in practice and how that works on a practical level. Okay, and then moving on to another topic, I related to the community, I've got notes here, related to the community discussion platform. It is, relatively new. We started late August. So the last newsletter that I put out at the very end of November, that also acts as it gives you a little community news, some community news summary at the beginning, but then it also has a platform navigation tool. So it has all the topics that we've been talking about and then hyperlinks to those topics, so that if you've been, really busy, like working on research or just diving into clinical stuff or something else, and you just haven't been back on the platform, you can go to this. And this is also uploaded as a PDF on that platform in the welcome series. You go to the welcome topic, and then that will also be available to help orient you. So there's a set of posts on welcome to help get you reoriented to how the new platform works. And then there's by topic, whether it's quality assurance or it's research, like what are the, up to late November, what are the most recent, or what are all the posts related on that topic. So it's basically a topic-based navigation tool. So I recommend taking a look at that. And something that happened just this past week was there was an AccuCongress virtual fly-in on December 8th that I participated personally in. And I know there was some interest for those of you who are interested in, like you've been dealing with Medicare is supposed to be covering acupuncture for low back pain as of January 2020 as part of their national coverage decision. But we've talked in the group about how there's been some trouble with that and why that might be. And then, so the latest information that I have about that, and there's a couple of blog posts, if you look up Medicare in the last year, we had a hospital, issues in hospital-based practice session with Dr. Kelly Bird Guymond, who is a federal legislation expert. And she talked about how all that works, federal legislation works, and how that ties into Social Security Act and Medicare coverage, because that's all about federal legislation, and how that relates to acupuncturists. It was a useful informational session. And it turned out to be good timing because this summer, Representative Judy Chu introduced a bill called HR 4803, Acupuncture for Our Seniors Act. And it's really simple. It'll be one of the simplest federal bills I've ever seen. Not that I'm the legislative expert that many of you who do this all the time are, or especially not like Dr. Kelly Bird Guymond, who is the integrative health legislative expert. Really simple bill. All it does is it includes licensed acupuncturists onto the list on the Social Security Act of the list that has all the approved providers. So that, we'd be on the list with psychologists and physical therapists, just, regular allied health provider type list. But one of the reasons this bill came about, the main reason is that our profession, the acupuncture profession, then the national groups went to Medicare and said, like, why are patients getting denied treatment by acupuncturists? And basically, I'm paraphrasing and summarizing. Medicare came back, or CMS, which is Medicare. CMS is Center for Medicare and Medicaid Services, which is a federal branch of the federal government, a department of the federal government. They came back and said, the reason is acupuncturists as a profession are not on that list of providers on the Social Security Act. What you need to do is you need to pass a bill that adds licensed acupuncturists to the Social Security Act, and then patients will start getting their acupuncture covered by Medicare. So basically what this bill is doing is we're following what Medicare told us to do. Just, checking the box that Medicare said this is what you have to do to make this work so that patients are getting care covered instead of getting it denied. So it just streamlines the whole coverage process as streamlined as it gets with Medicare. So for those of you who are physicians who work with Medicare all the time, like it's not easy. Medicare is its own system, but at least being on this list helps to streamline the process for coverage and reimbursement about as streamlined as it can get. Certainly, it's going to help overcome a lot of the barriers that are going on now. So on December 8th, I participated in a federal fly-in that AccuCongress, which Dr. Kelly Bird Guyman is also involved with. So AccuCongress helped set up this virtual federal fly-in. So I got to talk to my representative about why I care about it. So one of the goals that we have heard from Representative Judy Chu, who first introduced this bill, HR 4803, is that in the U.S., getting bills passed is a process. It's not just, you do one thing and it's done. It's like, has to go through all this different process to get passed. The next big thing is to try to have 100. Representative Judy Chu has a goal of having 100 co-sponsors to the bill to get it to that next level for this legislative session. So if you're interested in this, which I hope everybody is interested in this, because it just helps more patients be able to access our services. It helps us to really be able to work in hospital and healthcare system-based practice. It just streamlines a lot of things in the U.S. for our practice and our profession. To support this bill, very simple bill, I'll add a link about more information about this and how to engage in this. And I'm also, if some of you are interested in writing like a letter, like a general letter that people can kind of play around with specific to their situation from the hospital-based perspective. If you're already writing one, let me know, and it'd be cool to hear from different perspectives how to do that, how to kind of share that with colleagues. So let me know personally, it's fine. Yeah, and then, then the rest of my updates are all about research. So for those of you working in children's hospitals or working in pediatric acupuncture who also work with inflammatory bowel disease, there is a really cool nonprofit called Improve Care Now, and they like to review research proposals and support them if that fits their mission. So if you haven't heard of Improve Care Now, please go check it out, improvecarenow.org, and I will add it in the hyperlinks of the PDF that goes with this as well. And kind of check out like how to be involved both as a clinician, and then if you're interested in doing research and collecting data, because you should be collecting data on the work you're doing anyway. But if you wanted to have that as part of a more formal research proposal with your program, I highly recommend looking up this group. There is a new journal out. I've heard about this from Professor Kathleen Lumiere at Bastyr University. She has coordinated a new research journal just for acupuncture and East Asian medicine, specifically for publishing case reports. So I'll add that link as well. And I think, I don't want to tell you the wrong name, so I don't want to get the name wrong, but there is a title for that, and I will add that in the notes as well. In the Evidence-Based Acupuncture Forum, for those of you who didn't know, do you guys remember hearing Sandra Grassa and Mel Hopper Koppelman? Forgive me if I got her last name wrong. They are really good at talking about with evidence-based acupuncture. We've either heard them at a conference or you've heard them in a podcast interview. They're really good about talking about how to communicate about acupuncture research with confidence. And they have a whole video series now up and available in the Evidence-Based Acupuncture Forum on that topic to teach you, acupuncturists, how to communicate about acupuncture research with confidence to different people in the field. So I recommend checking that out. I will add that in the link as well. Those of you working in wound care clinics, I shared on the Hospital Handbook Project Facebook page, there is new research out from NCCIH, that's the National Center for Complementary and Integrative Health, about wound care and wound care clinics, and some of the I think it's just mechanisms of things to go check out. So I'll add that link as well. And the most recent thing that was posted yesterday, Friday, so today is Saturday, December 11th, is Christine Kaiser and her team at University Hospitals Connor Integrative Network they have a COVID long haul treatment program, and which was recently highlighted in their local news. So I've been sharing that. And so for those of you who've been on the forum for a while, we've been talking about what is the research on COVID and trying to learn about it as soon as it came out. We have a dedicated group just to discussing that, besides talking about it in the regular group, because there was so much going on, especially at the beginning of the pandemic, about that I had to move it into a separate group. And the main thing about the group is we just talk about any research that comes in, talking about, what it is, is it animal-based research, human-based research? Are we talking about, pharmacodynamics? Are we talking about traditional Chinese medicine, Chinese herbal medicine? Is this a case report? Is it a randomized controlled trial? Is it pragmatic? Are we talking about what the virus variants are? All these different topics. And so we have a separate blog post that kind of gives you a synopsis of what's been going on in the group the last year and a half. And I will add that at the end too. Well, thank you for getting with me through this so far. That's all I have for today. If you have questions or more news that you want to share, please message me via the website. So if you go to thehospitalhandbookproject.com and then go to the contact page, there's a form that you can fill out to share some news. Though the best way to share news is to join the community discussion platform and just share it directly with the community right there. So thank you for your time today. I hope that was helpful. Bye.